Well, South Africa's vaccination rate continues to lag despite an aggressive national rollout. Hesitancy is often cited as the only reason, but in rural areas, getting to a vaccine isn't always that easy. People don't know where to go, the sites are inaccessible or just expensive to reach. And a new program is addressing this in KZN and Mpumalanga and taking jabs straight to the people. Using community workers, they've reached thousands of people over the last few weeks. Dhirisha Naidoo is with BroadReach and has been on the ground with this project. Dhirisha, thank you so much for your time. It seems to make absolute sense that community workers would take the vaccine to deep rural areas, to the people because living there, because it's impossible often for them to get to a clinic, never mind schools, etc., because of infrastructure problems. Why only now?
So thank you so much, Annika, for having me on. And that's a great question. So through a wonderful opportunity from PEPFAR via USAID, we have now been given some additional support to support the Department of Health to actually move out into deep rural areas to take these vaccinations, as well as some comprehensive services to these communities. As you know, when you're in deep rural areas like the areas that we work in, which are predominantly rural, like you mentioned, access does become a problem. So now through local engagement with communities, local business, we are now able to take some roving sites, roving teams, set up in areas where people gather, set up at local businesses, engage them, and also have much needed health promotion and that one-on-one engagement with clients or people on the ground. So it's been great to have this opportunity.
Dhirisha, certain districts, I think it's 4 districts in KZN and in Mpumalanga, had really low vaccination rates of about 25%. How have you been greeted when you go to these areas with low vax rates?
So it's definitely a warm welcome. And if I can, relay a story from the field from last week, which actually was really inspiring. We were out in a deep rural area in Mpumalanga, and our team had arranged for a site setup at a local clothing factory. And there were about 70 staff members at this local clothing factory, of which none had been vaccinated. And through the leadership of the owner as well, who was the first to be vaccinated, we were able to then vaccinate all the staff as well. And we were not only able to just offer the vaccination, we were able to provide some services to them, such as HIV testing, TB screening, having your blood sugar tested, having your, your blood sugar and your high blood pressure tested as well. So it's definitely a welcome opportunity that people are seeing. And the feedback we've been getting, because we've just started implementing over the last 3 weeks, is that, they are happy to have people now on the ground talking to them in local language to address, some of their questions that they may have had, as well as now having someone come to them to offer the service, I think does make the difference.
I somewhat naively just presumed that the health department would take this approach and this initiative as common sense. So, I mean, well done to you. Quick last question. With, as you mentioned, HIV and TB, with COVID, has there been difficulty in compliance with those kind of meds for those people suffering with those with TB and HIV?
So I think addressing, HIV, TB, and COVID in an integrated fashion, like we've been doing together with our partners at the Department of Health, has made the difference, because we know that patients with chronic conditions, if they're not vaccinated, can actually have a risk of more severe illness, if they get COVID-19. So we are definitely an extension of the Department of Health, arm in trying to access these communities at large and working through the Department of Health to actually make, this possible.